The opinions expressed on the following sponsored program are strictly those of its host, guests, and callers that are not necessarily those of this station, its staff, management, or sponsors. Welcome to the STARS program, Seniors Taking Active Roles in Society, with your host, Anita Finley. Your comments and questions are welcome during today's broadcast. Call us toll-free at 888-721-0074. That's 888-721-0074. And now, here's your host, Anita Finley.
Well, good morning, everyone. Well, you've been filled with a lot of great shows. We started out with Mother Atasha. We went to Neil Myers interviewing Dr. Oz. Then we had Dr. Rosemary Mencia. And now we have someone very special. Calvin Glidewell is the CEO of Broward Health Medical Center and the Chris Everett Children's Hospital. You know, when you go by these big facilities, you say, what happens in there? Oh, I hate to go there because I usually go there because I have a big problem. But after talking with Calvin, I realized that there are so many great things that are happening, especially at his hospital. Of course, you know, Broward Health has a lot of hospitals all around Broward. But the Broward Health Medical Center is really, I guess it's the biggest one, or you've got the most responsibility, don't you?
It is a big place. Broward Health Medical Center, we're proud to be the oldest, so we're about 76 years old. The biggest, we're licensed for about 716 beds in total, and probably the most comprehensive hospital in Broward County. We really offer a vast array of services, all the way from neonatal services for the tiniest patients through cardiovascular cancer services, neurosurgical services for adults with perhaps more chronic conditions.
And I was telling Calvin as we were speaking that I noticed they have a liver transplant. I guess it's a department in a sense, and a lot of people who haven't had to have new livers have no idea what that's like. But many people years ago had to travel all over the United States for that. Now for you to have that, and you might want to talk a little bit about it because you've got something very special with that.
Absolutely. This is the liver transplant program is actually a partnership with physicians and surgeons at the University of Miami, and the Miami Transplant Institute team that does surgeries at Jackson Memorial Hospital is the same team that will actually come up to Broward Health Medical Center. So we've got the surgeons themselves, we've got hepatologists to really do the medical workup for patients that might need a liver transplant, and actually the anesthesia team from University of Miami comes up to do these very complex kinds of procedures that really are the last resort for patients who would need a new liver.
I know you're not a physician, but you should be. You've been around for so long. But how long, I'm just curious, how long does someone have to stay in the hospital after a liver transplant about?
Typically, I would say probably it's about a 2 to 3 week stay after a liver transplant.
Yeah, it's a very serious problem. But the fun thing that you do, and I know you love this, is the Chris Everett Children's Hospital. That's just tears at everybody's heartstrings, doesn't it?
Yes, ma'am. The Chris Everett Children's Hospital is a key component of our hospital, and it really encompasses a broad array of services. First of all, pediatric services really starts with obstetric services. So we have a brand new maternity place at our hospital with really luxurious, extraordinary maternity rooms for our patients that want to come deliver. And we do a little over 3,000 births at our hospital every year. And then we've got a very large neonatal intensive care center. We actually have 2 levels of care, a level 2 center, and then the most complex level, a level 3 neonatal intensive care center. And then as patients get a little bit older and they might continue to need some care, we've got a pediatric intensive care unit, we've got a pediatric hematology and oncology unit, and we've got a general pediatrics unit as well. So about 120 of our 716 beds are dedicated toward pediatric services. And really the depth and the breadth of things they do for the kids in our county is extraordinary. Like I said, taking care of really babies that are just a few grams in weight after
You don't
their
know this. I have to
firstborn.
interrupt you. I had one of my 3 children weighed 2 pounds 14 ounces and was
Really?
born into the a few days in the 7th month. But I lived in Miami, and I think I don't even, maybe it was Mount Sinai. I don't remember, but it was nothing like you're talking about, because that was 50 some odd years ago. I mean, they were just put into the hospital, where now it's different, isn't it?
It really is. We are one of a handful of regional perinatal intensive care centers, so we will really take care of the sickest babies that are here in Broward County. And we've got neonatologists, we've got pediatric intensivists, so really broad array of physicians to really deliver the very best care for the kids and babies in our county.
That's really a wonderful thing and you can be very proud of that, because I was just picturing it. I was thinking this little, and I did see some movies that they took there in that center in the hospital, and they're just, as you said, they're so tiny, but imagine when they go home. That must be a big celebration,
Oh,
isn't
absolutely. I mean, parents, you can just see them glowing with pride when they get to take their baby home after having spent, weeks, sometimes even months in the hospital. So we really are, we're pleased to offer that service. And as I said, we kind of started with a major expenditure and capital expenditure and focus on our maternity services, but we're really going to work with our community to see what we can do to grow and invest in our neonatal services and our pediatric services. In collaboration with our foundation, we really are doing a major fund drive. The cost of renovating our pediatric facility will probably be in excess of $75 million. So we really need our community to rally behind us. We want to be here to be able to take care of these very sickest babies in Broward County and have them grow into viable citizens. And so we need our community to work with us.
I'm so glad that you said that, because I was going to also tell people, when you go and you make out a will, it's very important to remember that if you want to live on after you've passed away, the best way to do that is to donate to the living places that are doing things for people. And it's whether it's a small amount of money or you're one of the fortunate ones and you can leave millions, that's fine. But people can leave, $5,000, $10,000, whatever it is. So that's why I'm very happy. I'll be having a lot of people from a lot of the CEOs from Broward Health on the show, because I love the idea that we can explain to people what happens in hospitals, and you don't really appreciate it till you have to go to one.
Yeah, we're very much a public hospital. All of the assets of all of the hospitals in the Broward Health system are really owned by the citizens of Broward County. And
that's well put.
It is important. I mean, we're community resources. I want to be a good steward of the resources that we have at our disposal to be able to serve our community and our residents as well as possible. But you are right. It's a difficult and complex healthcare environment, and we rely on our community for financial support when they're patients, but even after they're patients, to be able to give back to the hospital. And our foundation's done a great job in terms of being able to get some very nice contributions from area foundations to grow our services. But every individual contribution counts. And as a community hospital, as a public hospital, we hope that we can continue to provide the level of service that our citizens demand and expect for years to come. And we can only do it if we get the support and the commitment of our community.
My guest this morning is the CEO of course, what we've talked about, Broward Health Medical Center. It is the oldest one of all the centers. But what I'd like to say, though, is that he's here early in the morning, and it's wonderful. I mean, he has a very busy schedule, but he thought it was important enough to share what happens at the hospital, and he's very proud of what he does. He was at Imperial Point before, and he's now taken on a much bigger responsibility. So it's Calvin Glidewell, and if you will go down. I always take South Andrews Avenue from Broward all the way down, and this wonderful big building. In fact, one thing I noticed, not only you, but all hospitals now have valet service. I mean, this is lovely. You have valet people because, and then if you just sit there for a while and you see that people in their wheelchairs and other kind of people, before, I guess they had to go park and figure out how to get in. People had to drop them off. So I think the valet service is a very important thing, and I thank you for that.
Well, the hospital itself has really changed its focus from simply being a place where you come when you're very sick to really working with our community to be sure that we're reaching out, keeping people as healthy as we can, but making sure that we do have the services available if you've got an illness. And it's really a focus, a different kind of focus on the patient and the family member that we have today. Let me tell you just a little bit about Broward Health Medical Center because I am very proud of it.
I was going to ask you a little bit about you first, but go ahead, tell me about that.
Well, as I said, we're the oldest hospital here in Broward County, and probably in terms of scope of services, the most comprehensive. We have about 3,500 employees. We have about 900 physicians on staff, and we offer virtually every medical service from, as I said, neonatal services, cardiac services, pediatric services, cancer-related services, neurosurgery and general surgery services, maternity services, orthopedic services, Level 1, the most complex trauma services.
Yeah, I'm going to go back to that because I want you to talk about that after. Keep going. That's all right.
We've already mentioned liver transplant services and then behavioral health services because there's a big need in our community to really offer behavioral health services for patients that might have mental illnesses as well.
Oh, wow. You're just opening up. I don't know if we're going to get all this in. You'll have to be back another time. But let's take a few things. First of all, the emergency services. That's important. And, someone comes into the emergency room maybe because they just have something simple. But then you talked about trauma center. Why don't you discuss that?
Okay. Well, there's about 125,000 emergency visits to Broward Health Medical Center every year. So that is actually one of the busiest emergency rooms in the country. And we do get an array of kinds of patients that come in, but we're particularly proud to be able to offer Level 1 trauma services. So trauma services really are graded in terms of the complexity and the scope of trauma care that you can provide. And a Level 1 center like Broward Health Medical Center has to have an in-house trauma surgeon available at a moment's notice to really deal with automobile accidents, with perhaps a fall from a great height, gunshot wounds, all kinds of things might come into our emergency department. And we have a terrific service that is headed by one of our physicians, Dr. Nabil El Sanadi, who actually runs our Level 1 trauma services down there. So we offer trauma not just for adults, but for pediatrics as well.
And so this is the service where they pick you up in a helicopter if it's serious enough?
If it's serious enough, absolutely. You are picked up by a helicopter. We've got a heliport right on the roof of the hospital there. They rush you right down into the emergency department, and depending on the type of illness that you have or intervention that you might need, we'll get you into our neurointerventional suite, into our cath lab, into our surgery suite, within a matter of minutes, because we do have that trauma surgeon available on site with a whole support team that can be there within minutes to take care of you.
As compared to a typical emergency room in a hospital that does what?
Well, many emergency rooms are really geared toward medical illnesses, but it's not the kind of trauma that you might see associated
now
that you might need.
Like we see on television. Everybody comes running in.
Trauma 1 services, absolutely. That's the kind of services.
We see. This is how we know about hospitals, what we see on television. So we're just so happy you're here to get this kind of straightened out. Okay, so that's really very important that you shared that. But also let's let's go back into a typical, as people come into the hospital, and you were talking about the mental health aspect. Tell me, I didn't know about this.
Oh, absolutely. In the west wing of our hospital, we have about an 80-bed unit that really is geared toward patients that might have a need for they may be having a schizophrenic episode, so we need a psychiatrist there to kind of look at them. There's a whole program called the Baker Act program, so that if patients really are demonstrating that they might be a danger to themselves or to others, we've got psychiatrists that are immediately available to come in and evaluate the patient and either get a voluntary admission or perhaps be able to admit the patient involuntarily if they are demonstrating one of these kinds of behaviors that might be a danger to themselves or others.
And so most hospitals, I don't think, would have something like that, do they?
Well, probably only about 20% of the hospitals in the country would have a behavioral health unit associated with the hospital. So, and as you know, there are many, many conditions where there are comorbidities between medical illnesses and psychiatric illnesses. So we've got the ability, if someone has a behavioral health condition but has a medical condition, we can treat them in our hospital. So
that's excellent, because we know now that the focus is on mental health after you see what's going on in the country. And of course, a lot of our veterans coming back. And I heard the latest is that they now are going to be able, you're going to be able to treat veterans instead of having to go to a veterans hospital. I don't know if this is true. You may be getting more veterans in there now.
Well, we certainly want to offer our services to the veteran community. I know that they've had issues of late of some backups in terms of timeliness of care, and certainly all community hospitals, I think, want to make their services available to our veterans who've served our country so ably, and be sure that we can get them in as timely as they need their care.
Yeah, I was very happy. I always wondered why they don't go to regular hospitals, but I'm sure it's very political and I don't have to get there. But let's go back to who you are, actually, Calvin. And when did you get in? And we call you, you're a hospital administrator, but how did this all have come about?
Actually, I've been doing this for about a little over 30 years here.
That doesn't seem possible.
When I got out of college, I didn't know exactly what I wanted to do, but I knew I had some military service ahead of me, and actually chose the Medical Service Corps as the part of the United States Army, the branch of the Army that I wanted to go into. So I got my first exposure really in field medical units and ambulance platoons on the fields of Germany. So I got a little bit of exposure there to healthcare, and remember taking some of our troops through training for expert field medical badge training. And then I got assigned to a couple of military hospitals up in New Jersey, and eventually in New Orleans, Louisiana. So I got out of the service, decided that I wanted to go back to school. So I went to school and got a couple of master's degrees in business administration and in public health. And when I got out, did a residency for a hospital in Jacksonville. Spent a few years in Maryland, but have spent about the last 25 years in the state of Florida, either over in the Tampa Bay area or most recently here for about the past 7 or 8 years here in Broward County at Broward Health Imperial Point for a few years, and now for about the past 3.5 years or so down at Broward Health Medical Center. So it's been a long career, and I got to tell you, I've seen all kinds of hospitals, big ones, small ones, municipal hospitals, military hospitals, and there's really nothing like Broward Health Medical Center in terms of the kinds of things, the extraordinary work, the lives that are saved. It really is just a fantastic place, and a great place to be able to really cap my career at Broward Health.
Sounds like you're a great leader, and I always say a great leader produces those kinds of results. I notice when I do go there, people are very friendly, and that's something I think that's being everyone's proud of all the hospitals in the Broward Health, that from the janitor walking down greeting you. I mean, I was late for a meeting, and I think it was one of the other hospitals, and I was looking around. Must have been someone cleaning the bathroom, something. And can I help you? And I said, I'm late. Okay, and it didn't just send me; she took me.
Yeah,
I said,
well,
what is this? This is like a
absolutely.
hotel.
It is the focus on the patient and their family member. And we used to think of hospitals as these big buildings with this fancy technology. And we do have a big building. At Broward Health Medical Center, it's probably 1 million square feet of space. And we do have some fancy technology. We've got hybrid operating room suites and neurointerventional programs and
The Da Vinci robot.
The Da Vinci robot is one of the services that we offer. But at the end of the day, what people will remember about their healthcare experience is the connection that they had with their nurse and with their technologist and the communication that they got from their physician. So we really are focusing on the patient and family experience and trying to culturally be sure that we are listening attentively to the needs of patients, attending to their needs, making them as comfortable as possible. When you go into the hospital, typically it's a pretty frightening time. You either have an emergency or you've got a loved one, perhaps a child that's going through a difficult time. And we want to be sure that we offer as calm and reassuring an environment as we possibly can. That's why we want to make it easy for you to get into the hospital. You talked about valet services, our emergency services. We want to get you out of registration and into the back of the ER just as quickly as possible, because we know you want and you deserve to have your needs taken care of. So we've gone through a whole training program with our entire 3,500 employees and our 900 physicians to be able to refocus their attention and their efforts to not just the clinical needs, but to the emotional needs of their patients as well. And so we are proud of the change that we're making and the commitment to real patient-focused care that we have at Broward Health Medical Center.
Yeah, I really applaud you for that. And I'm not going to let you leave until we talk about the Women's Health Center, which is like a spa. When you walk in there and the colors and the personnel, your wonderful physician who's in charge there. I think she's an obstetrician. I forget. I met her and I don't remember, but that's impressive. You may want to share that a little bit.
Sure. The Lillian S. Wells Center is on the first floor of the hospital, and it was really geared initially toward diagnosing and treating breast disease in women. And we wanted to, again, that's a scary time for women in their life when they've got to go in for their mammogram, and particularly if they've found potentially a lump and they need to go through some treatment for that. So we want to make it calm and reassuring, and we want to make sure that it's as expeditious and efficient as possible so that we can get our patients their test results as quickly as possible and perhaps put their mind at ease. And if they do need treatment, that we can get them immediately into treatment with either a breast surgeon or a radiologist that might do an ultrasound procedure to further diagnose their disease. But it is a beautiful center. Now, we broadened the concept a little bit, so it's really not just for women with breast disease anymore. In fact, we now have physicians coming in to timeshare some of the offices that we have there. So we do have obstetricians and gynecologists. We have a urogynecologist that might deal with incontinence in middle-aged and older women. We've got plastic surgeons there because women might want to actually get some advice on what they might want to do to their bodies to improve their self-image a little bit. So we broaden the concept from just women with breast disease to really treating the entire woman and making sure that we can meet all of their needs in the Lillian S. Wells Center.
I was told you can have a massage there.
You can absolutely have a massage there.
They really gave us a tour of it.
I've been known to sneak out in times of stress and have a massage there. So.
Well, this is all part of the good health. We know about that. Well, I'm really very happy that you were able to come here today to share this experience so that people aren't as afraid, that they do know what is available there, and for people to realize that, and I'll go back and talk about Broward Health, that they do have a great foundation and they do have to raise money to be able to make these things happen. It doesn't come from, just out of the air. But I'm really glad that you especially are going in the right direction. I think that people will not be afraid of hospitals. There are some people that would say, I'm not going to a hospital. You've heard that before,
yeah.
Because years ago, I guess it was frightening, but now it is very friendly, and it really is the patient. I think you've put the patient first before
really
everything
is
else now.
That focus on service to the patient.
Right.
As I said, they'll come to the hospital because they need the extraordinary services of our tremendous medical staff or some of the complex technology. So that's why they'll come. But what they will remember is that personal interaction with their nurse and the support system that our entire team of employees might give to them while they're in the hospital. And that's what they'll go home and talk about. So we want to make it as warm and reassuring and comfortable for them as we possibly can if they have to be in the hospital. And you're right. You talked a little bit about the need for philanthropy, and it's a difficult environment out there. I mean, we're now faced with extraordinary changes in healthcare, with the advent of the Affordable Care Act. The pace of change and the magnitude of change is tremendous. The reimbursement pressures on hospitals are tremendous. The federal government, the state government really doesn't have the funding that they used to have in the Medicare and Medicaid program. So we rely on commercial insurance. We rely on providing extraordinary service to patients so that we can attract people to our facility to be able to offer care to everyone. Broward Health Medical Center is truly a safety net hospital that really delivers care to the entire population without regard to the ability to pay. But in order to do that, we need to attract patients that do have insurance to our facility, and we need to work with our community to be sure that we can encourage them to philanthropically give from of their generosity back to the hospital.
Yeah, stop leaving your kids these red Corvettes because it's not good. Let's leave the community something, and it's a great way to do this. So Broward Health, well, you can, if you want to give some money, you could start off by meeting Calvin Glidewell, who is the CEO of Broward Health Medical Center, and then he'll steer you into what you may want to do. There are people who actually name part of the center, part of the rooms. There's all the sorts of things that people can do, and it's a great way to have your name in posterity. And there are a lot more things that are going to be happening over there at the Broward Health Medical Center as well as the other Broward Health hospitals. They're really trying to do everything that Calvin said, and we appreciate your coming here so much. And we'll be looking forward to having, the Chris Everett Children's Hospital is extremely important, and we hope that we never have to bring our children there, but at least we know where I have 8-year-old triplet grandchildren, but unfortunately they live in Miami.
Okay.
So they're not coming up there, but it's a good thing to know about anyway, right? Well, thank you very much, Calvin.
My
it was
pleasure.
wonderful having you here, really.
We're glad to be here, really, as a community resource. I appreciate the time with you, and if you want to come visit us, we'll show you around what we've got here at Broward Health Medical Center. So thank you very much.
You're welcome. Okay, well, we're going to take a fast break, and then we're going to go to our next guest, so just stay with us.
The one and only Boomer Expo is coming to town Friday, July 25th from 10 to 4 at Seminole